Okay. Eh? Joki, I think we can start. Joki, I think we can start.
Okay.
Oh, thank you.
Okay, good evening, everyone. My name is Joki Washira, and I work for Equalize Health. I welcome you again to this 7th session of the COGS Elementary series on strengthening obstetric and gynecologic care for maternity teams. Today's topic is on attitude, communication, and teamwork in maternity care. Equalize Health has partnered with COGS to bring you this online training series. We have implemented these telementoring programs in health professionals in India and in Africa. So before we begin, let's start with a bit of housekeeping announcements. Let's try and keep ourselves muted unless we are talking. Let's also keep our videos on if possible. And we can respond to questions without any hesitation. You can also feel free to post any questions on the chat box. So I'd like to welcome Dr. Kigondu to introduce our speaker for today.
Thank you very much. Thank you very much, Njoki. Our speaker today is Dr. Winnie Mwebia. Dr. Winnie Mwebia is obstetrician gynecologist who graduated from the University of Nairobi. She also did her undergraduate at the University of Nairobi. She's a consultant OBGY at Ishihara Sub-County Hospital. She has worked in the public rural facilities for more than 10 years now. She is very keen on improving quality of maternal care through adoption of evidence-based practices, as well as fostering teamwork in maternity units, and hence her topic today, attitude, communication, and teamwork in maternal care. She's passionate about maternal health, safe motherhood, and has several research publications in the field of maternal health. She's also the coordinator of this particular program, having initiated. Without much further ado, I welcome Dr.
Okay, so good evening, everyone. And thank you once again, Dr. Kigondu and the Equalize team. Thank you for the good welcome. And I'd like once again to thank everyone who has supported this series. First, the Equalize team. You have given us immense support in the logistics of this series, as well as in the provision of this digital platform, the Zoom platform that we're using for the series. And the COGS team, represented by Dr. Kigondu here, he has been very instrumental in also organizing and moderating these sessions. Thank you, everyone. So as you've heard this evening, our topic is attitude, communication, and teamwork in maternal care. And as you've noticed, this week we are taking a bit of departure from the usual clinical learning to the other soft skills that are involved in delivery of quality maternal care. So next on Wednesday, we shall be looking at research by Professor Wanyoro. So you can see the theme for the week. So without further delays, we'll delve right into the topic. And let me go to slideshow. Okay, yes, so there we are. Our topic is attitude, communication, and teamwork in maternal care. So this session will have a lot of interaction because, yes, we want to foster teamwork even in our learning. So, and our first brainstorming session, what's your understanding of teamwork? What are the benefits, if any, of teamwork to patients, staff, the healthcare system in general? And what are the disadvantages of teamwork, if any at all? So we can have maybe 2 volunteers to maybe give us their definitions of this. Anyone willing to unmute and speak? I see Meristella Wamalwa has raised her hand. Maybe if you could mute yourself and speak.
Okay.
Are you speaking?
Is
we can't. We didn't get what Meristella said.
Her internet is bad.
The network is poor. I propose that people can type for 30 seconds on the chat and then we read out some of them.
Okay. So I'm
We
already
have
seeing...
a chat there. Yes, excellent.
Yes. Okay. We have Joshua Juma. Joshua says that teamwork is working together for the betterment of our services. I agree with Juma. Then we have Priska. Priska, teamwork is working together for accomplishment of better service. Anthony, teamwork is combined efforts, a team consisting of different members with a common goal. Okay, so groups of people, Lucy Mukami, groups of people who work together through effective communication to achieve same goals. Winning Jerry, teamwork is the collaborative effort to achieve a common goal in a more efficient way. Collective actions of a group to accomplish a common goal. Excellent. I see I have an excellent team here and the theme is quite similar. So we all seem to agree that teamwork is people working together in a group and for a common objective. That's the theme that's coming out. So any responses on benefits of teamwork? Okay, still working together on a common objective. Okay, I see we all have the same understanding of teamwork. So, okay. Sorry, my screen is hanging a bit. Okay, so yes, in introduction, so a team, as you've rightly said, it's a set of 2 or more people who interact dynamically, interdependently, and adaptively towards a common goal and a valued goal, objective, or mission, and who have been assigned specific roles or functions to perform and who have a limited lifespan of membership. So this is the definition by the World Health Organization. So yeah, the key things that come out is people working together, and then the interaction is dynamic, meaning it changes from time to time. And then these groups tend to change also from time to time. You may be in the same team with someone today, and then tomorrow you're not, or teams can be reconstituted at any given time. And then there's also the aspect of shared goal or objective and mission. So multidisciplinary team working, or what commonly called MDTs in healthcare, are known to lead to better clinical outcomes, and not just outcomes, also the experience for patients, and also creates a better quality of working life for the staff. So this goes against the traditional hardline professional roles and demarcations that often lead to barriers in communication and expression. So this is a paradigm shift. So in situations where there's no teamwork, then you tend to find that there are members of what is supposed to be a team who are maybe more revered than others. And then there's usually a breakdown in communication in these setups. And you can tell that the clinical outcomes in such setups are not very good. So in an effective team, members communicate with one another, as well as combining the observations, expertise, and decision-making responsibilities so as to optimize care. So the benefits of teamwork are many. So first of all, teamwork plays a critical role in patient safety. Remember, our patients always come first, as well as the outcomes. So our teams have the power to either enhance or jeopardize safety of patients, and a team that is not working well multiplies the errors, the possibility of error. And those that work well, it's more than, the outcome is more than the sum of individual persons involved. So what this means, if I give an example, for instance, maybe a clinician or a doctor has seen a patient coming into the ward, and they are prescribing a certain medication, let's say penicillin, and you know that some patients tend to have allergy to penicillins, which can be fatal. So if, let's say, the first person to come into contact with the patient omits that part of the history that the patient is allergic to penicillin, goes ahead and prescribes penicillin, then the nurse who comes to administer the medication, without even taking any further history, just administers the medication. You can see where this is heading. You can even end up losing a patient due to that error. But if you're working in a team, the nurse comes in and maybe discusses with the doctor, this is the history of the patient, and the patient is allergic to penicillin, can we change to this? You can see the kind of a catastrophe that can be averted by just that simple kind of teamwork and working together in consultation. So, so teamwork adds up more than the sum of their parts where safety is concerned, and additional defenses against error by monitoring, double checking, and backing each other up. So when one is struggling, another one assists. When one makes an error, another one recognizes and rectifies it. So the other benefit of teamwork is the impact on overall quality of care given. So when people work together in unison, especially in maternities, you tend to have more respectful care. The clinical outcomes definitely are better, and with better clinical outcomes, so also the psychological impact on the patients is more and more positive. And then this also affects the future health-seeking behavior. So if a patient has had a bad experience in one institution or generally with the health system, they're not likely to seek care in the same health system again. They're going to avoid it unless when absolutely necessary. And then also this fuels the attitude of the public towards the health workers. Give good, respectful care. Also, the attitude of the public towards us, the caregivers, is different and better. And also it has an impact on medical legal suits. So in many circumstances where patients or relatives seek legal redress because of malpractice or what is thought to be malpractice, it is known that most of the time the main problem is not even the actual practice, but the communication that was there and the kind of relationship that was there between these patients, the relatives, and the health system. So having better relationships and having better basically having better relationships and giving better care to these patients will lead to less medical legal suits. This also fosters efficiency in care delivery and lowers healthcare costs. So if you have less death, less disability, shorter hospital stays because of the efficiency of the system, then also the cost on healthcare in general is lowered. So it also has a positive impact on the psychological well-being of staff. So it averts chaos at the workplace. I'm sure probably most of us have had an experience with an environment where they felt that it was not a positive work environment and the kind of stress that people get from such an environment. So also therefore for the psychological well-being of staff, teamwork is critical. And also we know healthcare workers are also affected by bad outcomes of patients. So if you keep on getting bad outcomes, that has a psychological impact, and the reverse is also true. So also having clear roles and responsibilities, which is the ideal of a team, has a lot of, again, psychological impacts. And then in a team, you get to know your team members better and utilize one another's key strengths, and those with weaknesses, they are buffered within the team. So also that improves the psychological satisfaction of the staff involved. So on to the second brainstorming session. So in your individual maternity units, who are the various professionals who make the multidisciplinary teams that we are talking about? So in those teams, again, who is the most important member in the team and why? And who is the senior most member of the team? Maybe we can take a few minutes and look at the responses. Okay. I'm not seeing any response so far. Okay, we have a response from Joshua Juma. The various team members, we have midwives, we have clinical officers, medical officers, nurses, medical officer, pharmacists, support staff, nurses, medical officers, all healthcare professionals. All members are important. There is no most important person. Okay, I'm seeing the responses are flying in quite fast. I'm missing on others, lab techs, midwives, senior most, all are important, all healthcare workers, records, drivers, lab. So excellent. Seeing all cadres are important. Okay, so let's see. So for maternity teams, these are the team of clinicians caring, and by clinicians, I mean healthcare workers, caring for a woman and her baby during labor at any given point in time, and the wider team involved throughout the pregnancy. So the objectives for maternity teams are quite relatively clear-cut, and that is to provide safe, high-quality care for both mother and baby. But is this always the case in our maternity teams? So the different teams involved in maternity care, we have different types of teams. So we have the core teams. These are the teams involved directly in the clinical care and management of the parturents and their neonates. So these would include nurses, clinicians, doctors, anesthetists also, lab staff, pharmacists. All these are involved directly in clinical care, be it in theater, be it in processing of the different labs and all that. Then we have another type of team, the coordinating teams. So these are the groups responsible for day-to-day operational management, coordination functions, and resource management for the core teams. And these may include the unit in charges and the heads of department. So we also have contingency teams. These are teams which are formed for emergent or specific events, such as in obstetric emergency teams and other specialties. We have physicians, surgeons, basically any other specialty. So for instance, if you have, let's say, a patient with thyroid disease in pregnancy, you would involve a physician. If you had maybe a patient with an acute abdomen in pregnancy, you would involve the surgical team. So now those make up the contingency teams. Then we have teams involved in ancillary services. These are the teams which provide specific and direct but non-clinical support to patient care. So these would include the support staff, cooks, cleaners, and all that. Then we have teams involved in support services and administration. They provide specific, however, indirect and non-clinical support to patient care. These would include biomedical staff when they come in to check our equipment, hospital management, executive leadership, and such. So just maybe before I move from this, it's to state that, as you rightly stated in the chat, that all members of different teams are equally important because each and every person carries out their different designed roles. And even if you look at some people like the support staff, if they're not there to clean the wards and all that, then you will not have a safe and clean environment to take care of the patients in. So everyone is important in their different roles. So we have different stages of team development. And we have the forming, storming, norming, and performing. As we've noted, teams keep on changing every now and then. So in the forming stage, this is the initial stage where there may be a bit of ambiguity and confusion as the team members get to know each other. Remember, sometimes people are just assigned to come together. They don't choose to work together. So here they tend to communicate in guarded, superficial, and in personal manner. And at the beginning, team members may be a bit unclear about their specific tasks. Then the storming stage. So this is once the team members have started to know each other, and there may be conflict between members and even some rebellion against some tasks. This is where now different personalities come in and may start clashing. So team members may compete for various positions. Someone may feel, no, I should have been assigned the team leader here. No, I should have been given this position. And this happens before the team begins to confront the task at hand. So, so the team members may compete for position and there may be frustration at the lack of progress in the task. Then comes in the norming stage. So people have known each other now, they've known each weaknesses and strength of the different team members, and now begin to open up. And now communication opens up between the team members and they begin to confront the task at hand. So the generally accepted procedures and communication patterns are now established. So after the norming stage, the last stage is the performing stage. So everyone knows each other and everyone has taken their different roles and positions. And now the team focuses all its attention on achieving the goals. So the team is now close and supportive and open and trusting, resourceful and effective. And the time taken to move from each stage to another may vary from team to team, again, based on various issues that we're going to look at. And we may have even an old team that has been there for quite some time, but they've not yet reached the performing stage yet because of the various barriers along the way. Okay, so another brainstorming session. From what we've covered, at what stage of team development do you think your maternity team is? Wherever at your workplace, are you still in the forming stage where there's a bit of confusion? Are you still in the storming stage where there's a lot of conflict between members? Have you reached the norming, or you're at performing stage? And then the second question, I think from observation, one of the things that contributes to frequent changes in maternity teams is the reshuffles that tend to take place a lot, especially with the nursing teams. For the medical teams, maybe the changeovers, especially in centers which have interns, when they're changing from one rotation to another rotation. So what's your opinion on these frequent reshuffles in maternity teams? And then the other question, with reasons, rate the level of teamwork in your unit. Do you have any teamwork at all? No teamwork, okay teamwork, good teamwork, or what you can call excellent teamwork? And then what are some of the barriers to teamwork spirit in your workplace? Okay, so just going through the chat, and I'm seeing the answers have come in quite a lot. So from what I'm seeing, most of our teams are in the norming stage, where they are getting to know each other. I can see some already in the performing stage. I can see one in the storming stage, so meaning there's a lot of crises and conflict in your team. So yes, there's another one in the storming stage. Then seeing a response about the reshuffles, it affects performance. Okay, another response on reshuffling. It helps to maintain continuity of service without losing focus and avoidance of overdependence on one particular person or team head. Okay, that's good. Then on the level of teamwork, I'm seeing, yeah, there are those with good teamwork, that's excellent. We have good teamwork, teamworking, good teamwork, okay, teamwork, norming, good teamwork. And there's someone with a who was named a barrier, poor attitude, good teamwork, okay, teamwork. Reshuffles, the question on reshuffles, especially if done so often, leads to poor outcome. Reshuffling affects service delivery. Then another one, superiority and inferiority complexes are a barrier to teamwork. Norming, so barriers, you find yourself alone at work due to shortage of staff, level 2 and level 3. That's a common, that's a common occurrence in our current healthcare system. Reshuffling is good as it gives good experience to all the staff involved. That's a good view. Reshuffling plus shortage of workers. So someone else says reshuffling helps all teams to be competent. That's Catherine. And Wandere, reshuffle done if objectively reduces institutionalization. So ineffective communication is a barrier. Then another barrier, frequent staff changeover. Another barrier, lack of motivation. Okay, so I'm saying there are so many, we may not be able to go through all of them. Yeah, but we can pick out a few. What I've noted is that most of our teams, I'm trying to go back. Sorry for that. So most of our teams seem to be in the norming stage. So this is the stage of open communication, where open communication has been established and members have begun to confront the task at hand. So I'm seeing few of our teams have reached the performing stage, and maybe we are going to find out why if we have time. Okay, so also I'm seeing that many of us take the reshuffles positively. We've given various reasons, and yeah, one person has rightfully said if done well, it's a good thing. It reduces burnout because we know maternities are high pressure working environments and all that. And with the level of teamwork, I think at least from what we have seen, most of us have good teamwork. Some barriers people have talked about communication, attitude. Others have talked about inferiority and superiority complex. Okay, so let's see what are some of the common problems with maternity teams. So one of the problems comes in with interprofessional working. So as we have noted, the maternity teams consist of different professionals working together. So especially when it comes to this influence between midwives and obstetricians, depending on the kind of individuals and the teamwork involved, this can be a barrier. And this may stem from the background of the training that these two different teams undergoes. So if you look at the training of midwives, it's mostly directed towards conduction of normal deliveries and mainly normal labor. If you come to this other side of obstetricians, we are mostly focused on the complicated deliveries in terms of cesarean sections. So our strengths vary. So the midwives are stronger with the normal deliveries, then the medical teams led by the obstetricians have stronger in the surgical aspect of the complicated deliveries. So that at times can create a push and pull. But again, if we have good, clear communication channels and good teamwork, this should not be a problem. So the other problem may be the rigid hierarchical structures. So when it comes maybe, yes, to let me talk about especially the medical team, where you may have the first on call, depending on the teams available. You may have the first on call as a medical officer intern, then get the second on call is a medical officer, the third on call is an obstetrician, or if it's a training institution, a medical officer, then second on call, maybe a registrar, then a third on call, an obstetrician, and so forth. So if you're very rigid about these structures, that the first person to see the patient has to be this first on call. If maybe there's a problem in the ward, the first on call we have to contact the first person to be contacted should be the first on call, then that can also affect, because sometimes you may have a situation where you have a dire emergency at hand. Let's say it's the first week of the medical officer interns in rotation. And here you know clearly that they're not able to perform cesarean sections on their own. Then here, as the nursing officer covering, you have a patient comes in with a cord prolapse. So Do you still have to go through the medical officer intern, or you can directly call the medical officer and say, I have a cord prolapse? You can prepare yourself to come and then now call the medical officer intern, maybe to come and prepare the patient. So it doesn't always, you don't always have to have the rigid hierarchical structures, depending on the various situations at hand. Then again, we may have differing opinions for normal birth versus various interventions, and differences in opinions will always be there. What matters is how these issues are approached. Are we raising issues in a professional and respectful manner, or the opposite? So the other common problem that can come in is team leadership. So the team leaders, the overall department or the hospital management teams, on things like the staffing norms, where someone has said that we may have dire shortages of staff, and that creates strain on the existing members. And when people are under pressure at work, even the fuses may tend to be shorter than normal. Again, the shifts that we are talking about, if they're not done well and objectively, if you keep on reshuffling teams with no clear objective, then it may bring a problem, because just when you're having a team that was getting to the norming stage, then you dismantle again and you have to start all over. The other common issue is the issue of supplies. I think that is also a common problem in our current health system. Again, leadership now within the various teams involved. So on the team of midwives, obstetricians, and other teams involved like anesthesia, if the leadership within, like maybe in terms of even having proper duty rotas and all, if there's a weakness within various teams, then it will affect the entire team in general. The other big problem is the communication. So communication is only effective if the relevant information is made available to and understood by those people who need to act on it. And maybe a good example would be in the conduction of ward rounds, where the clinical teams come together. So the decisions made in those ward rounds, they are affected by different people. Let's say if it's for drug issuing, it will be affected by the nursing team. It's for investigations, it will be affected by the clinical teams. So if the teams involved in acting are not aware of the decisions made, then that's a breakdown in communication, and it will bring a problem in the maternities. So referrals from one professional to another, especially in situations in need of close monitoring. If this patient has had some postpartum, some hemorrhage, and needs close observation, when you're transferring to the postnatal ward, for instance, and if this message does not reach to the persons in there, to the teams in the wards, then you may miss that part of the monitoring and end up with a bad outcome. Again, handovers at shifts, at time of shift changes. If critical information about patients is not handed over, then again, that may affect duty rotas. We've had situations where there's an existing duty rota in the ward, and then maybe some changes are made, and other teams are not made aware. So this will also cause a communication breakdown when the person is needed to act on the patients, and they're not. So consultations during emergencies, they require accuracy and presentation of information, accurate presentation of information, which can be done on phone or in person. And this is where, again, we're saying hierarchical calls may cause unnecessary delays. So again, Inefficient teams, that's teams without tasks. If you have team members who have not been assigned specific tasks, then they are redundant and may not contribute in any valuable way. Teams without freedom and responsibility, when you assign persons responsibility, you give them space to work. Of course, there'll be accountability and supervision at the end of the day, but it's good to give them space and responsibility. Then if you have 2 large teams, so the ideal size would be about 6 to 8, and larger than that, break down into subgroups. So you may have an entire department, let's say it has 20 or so nurses, but then they'll be broken down. Maybe this is a team that will work in labor. This is a team that will work in antenatal. This is a team that will work in the postnatal area, because people tend to work better in smaller teams than in. When people focus on individual work rather than teamwork, again, that is a problem. And then when you have leaders who are dictators rather than leaders, they don't listen to the opinions and views from the team members. And then when you have strong teams, strong personalities in conflict, again, that may be a problem. Okay, so on to another brainstorming session. So having seen some of the pitfalls of teamwork, how can we foster successful teams within our maternity departments? And how does attitude affect teamwork and patient outcomes in general? So I don't see, do we have answers coming in for that yet? Dr. Kigondu, maybe you can help me go through the chat.
We don't have answers yet.
Okay. So do we have volunteers, anyone with good internet who'd want to volunteer and unmute themselves?
So yeah, we've started getting some responses on chat. Jeffrey saying by having a minimum manageable number of people, at least 6 to 8. Nancy says outline clear goals and objectives for the team. Davis says sober and focused team members. Fetzal says clarifying roles. Lucy says enhancing good communication skills.
Okay, so
Timely communication to the team, effective communication among members. Positive attitude improves outcomes while negative attitude lowers outcomes. Enough staff. Enhanced communication, capacity building, good interpersonal skills. Manageable workload, avoiding hierarchical calls. Respect for each team member. Having clear goals. Shared decision making among team members.
Yeah, sure. Proper, accurate, and timely handing over during shift changes. Setting an objective team with SMART goals to meet. Good communication. Positive attitude improves care on our mothers. There are quite a number. There's again positive attitude from Margaret. And then we have task allocation evaluation. And Rosemary says, oh, they're going too fast. Motivation of team members and appraisal. Yeah.
okay, so I think we can, those are quite a number of responses on how to foster successful teams. So many people have talked about communication. So yeah, communication cannot be overemphasized. It comes in very key. Then there's another recommendation on respect between the different team members. Again, very key. It does not matter who which member of the team we are talking about. Then shared decision making. Again, this is very critical. So it's good to involve the different team players when making decisions on patient management. Having good and clear objectives. Yes, that's another common theme that has come out. Okay, then the other question, how does attitude affect teamwork and patient outcomes in general? Okay. Those ones have not started coming. Okay, one of them.
So we have poor attitude leads to poor clinical outcomes. That's from Lucy. And Doris says continuous mentorship.
Okay. I think she meant one way to foster teamwork. Yes, thank you for bringing that up. Mentorship is also very critical, especially within the different teams. So like in the nursing teams, the junior nurses can be mentored by the senior nurses. In the medical teams, again, the consultants in the teams or the medical officers can mentor the juniors in the teams. So
we have other answers to that. We have negative attitude amongst the cadre can lead to negligence in patients. Then we have simulation. Positive attitude leads to good outcome. That's Margaret. Members who know what to do hold their ideas, hence the patient is the one who suffers. That's I'll respond also on attitude. Attitude affects commitment, and Nancy says bad attitude affects care of patients. So by respecting each other's opinion, that's Betty.
Okay. So yeah, those are very good responses. And once again, we seem to agree on one thing, that attitude definitely affects our patient outcomes. If we have bad attitude, then we tend to get bad outcomes. And as we said earlier, that also jeopardizes the safety of patients. Positive attitude brings harmony in a department. Negative leads to dissatisfaction of care. Poor attitude ruins the institution's reputation. Positive attitude leads to great performance. Positive, so you can see the link between attitude and outcomes. It's a direct kind of a relationship. Okay, so moving on to the last part. Okay, frozen. So creating successful maternity teams. So what do we need to do? As we've rightly said, have effective communication within our teams. So, and communication can only be attained if there's mutual respect for various teams and within and between individuals within teams. Also, another important aspect of communication is documentation. So proper documentation on a plan of management, if it's the treatment, if it has been issued and all that, proper documentation. And then for emergency situations, there's the common SBA technique of communicating. So S stands for situation, B stands for background, A assessment, and R recommendation. So for the situation, you need to tell the person you're talking to or consulting what's going on with the patient. So for instance, I'm calling about Miss XYZ. a new admission to maternity, chief complaint, she has low abdominal pain following a fall on the abdomen 1 hour ago. So that's very short and concise. Then the background, what's the clinical background or the context of this patient? So this is para 1 plus 0 gravida 2 at 32 weeks gestation by dates and has no ANC scan. So that statement alone tells the person who's listening that this is quite an advanced gestation, 36 weeks, we are near term. We're in the late preterm period. Then by the fact that we have no antenatal scan, we don't know a few things about this pregnancy. We don't know the placentation and a few other things that we may be interested in a patient with blunt abdominal trauma. In assessment, what do you think the problem is? The person who is calling. So for this person who's calling, she feels that she says that her blood pressure is normal, but she's tachycardic at 110, 10 down the lower abdomen, and has slow and faint fetal heart sounds. So already the person on the other end may start thinking in the line of probably a rupture, because we're having a tachycardic patient, and the tenderness and also the fetal compromise. So the recommendation, even as you consult, you at the back of your mind, what would I do to correct it? So you may say, I think she has a concealed rupture with fetal compromise. Should I take her in for emergency cesarean section or whatever? That's just one scenario. So the ESPA technique, very important in emergency situations. So the other thing that can be done to create these successful maternity teams is having a common objective and measurable goals. So team members should generate this common and clearly defined purpose that includes collective interest and demonstrate shared ownership. So the teams set goals that are measurable and focused on the team's task. And this can be aided by performance planning and appraisal. So for instance, if you have the objective of to improve post-surgical outcomes, then one of the goals may read something like reduce day 1 average patient pain score by maybe 50%. So if you had most of your patients crying out in pain on first day post-operative, your goal maybe would be to reduce that to half. And then the other goal may read something like reduce surgery waiting time for emergency procedures. Maybe if your average currently is 1 hour, to reduce that by 30 minutes. So as you plan around your different activities, then they'll be geared towards reducing this waiting time. So the other way is through effective leadership. So this leadership that sets and maintains structures, manage conflicts. Conflict resolution is very key. Listen to members, trust them, support them. So another thing is good cohesion. So cohesive teams have unique and identifiable team spirit, commitment, and have greater longevity as team members want to continue working together. So this can be formed based on individual characteristics, strengths, and weaknesses. So the other thing, mutual respect. So respect talents and beliefs of each person in addition to their professional contribution. In addition, effective teams accept and encourage a diversity of opinion among members. Okay, so you can have varying opinions, but at the end of the day, come up with a common plan of management. Okay, so to build strong teams, you must see someone else's strength as a complement to your weakness and not as a threat to your position or authority. So maybe in conclusion, we can say that teams, so working together, everyone achieves more. So what's your take-home message from all these things? What would you say your take-home message for the evening has been? as we wrap up.
I think I can see a response from Bernard. He says, right attitude highly increases overall performance and clients get equity.
Okay. So maybe as we wrap up, I would say that even as much as we put emphasis on the clinical skills, also we have to look at these other soft skills of teamwork, communication, attitude, because as we've rightly discussed and seen, they have a very big implication on the overall outcome of our patients. So I'm seeing a number of responses on the chat. Yeah, so take home message: teamwork saves lives. Teamwork is the way to go. We need each other in. Oh, they're coming in very fast with barely giving time to read. Best teamwork, best outcome. Teamwork, good outcome, job satisfaction. Teamwork is key in healthcare delivery. Good communication improves outcomes. Embrace teamwork, and they are so fast. Teamwork is essential for good outcomes. Teamwork is the strength of every successful care delivery. Take home: everyone is important as a team member in healthcare delivery. Good communication is of essence, not only for overall outcome, but also gives you chances to improve oneself. Every person has a role to play in teamwork. Okay, excellent. Keep them coming. Meanwhile, I think we have come to the end of our session this evening, unless we have any burning questions. So the presentation will be available on the COGS Society YouTube page, like the previous 6 presentations. So subscribe and listen as many times as possible. Okay, so thanks everyone for coming and for the great contributions that we've had. I hope that we shall apply these lessons in our different workplaces. So over to you, Dr. Kigondo.
Thank you very much, Dr. Mwebia. And I think I commented earlier on some of the examples you've used are excellent examples of what actually happens in the maternity units. And I think your presentation was spot on. And we encourage members to subscribe to the Kenya Obstetrics and Gynecology Society YouTube page and tell their members to actually watch this presentation, because overall our aim is to improve maternity teams. So over and above those who are here in this presentation, you can listen to the presentations over and over again, and also get your members to subscribe. Our aim is to ensure that we have efficient maternity teams with good attitudes, communication for better patient outcomes. On Wednesday, we will be having research, a very important topic by Professor Wanyoro. We welcome all of you, and welcome all of you to invite your colleagues to be there with us. Thank you very much, the Equalize team of Lakshmi, of who else is here? Joki. I think Joki is here, and Enoch. Thank you very much for the facilitation. And with that, we want to bring this session to an end. We like to keep them short and sweet. And let's see you on Wednesday, same place, same time. Thank you very much.
Oh, thank you, everyone. Good night.
Thank you for the excellent presentation, Dr. Winnie, and see you all on Wednesday. Have a good night, everyone.
Thank you, everyone. Thank you. Good night.